Chondromalacia patella is characterized by a pain on the underside of the kneecap during movement. So in this video, I provide some exercises that are considered optimum for treating this condition. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I'm going to provide you with some exercises to help treat the pain under your kneecap. If you're new to this channel, we offer tips, advice and exercises to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Chondromalacia patella, also known as Patellofemoral Pain Syndrome and often referred to as runner's knee, is generally experienced in athletes or very active people that frequently perform a high volume of high impact activities, but it can also be present in someone who is less active but very overweight. The pain or tenderness is felt on the front of the knee and can be caused by excessive overuse of the knee joint, poor alignment of the kneecap due to a muscle imbalance where it rubs against the thigh bone, and can either be linked to biomechanical abnormalities such as flat feet. This condition makes up approximately 60% of all people that experience anterior knee pain, and on assessing individuals with it, most are found to have weak quadricep, hip external rotator and glute muscles, as well as tight hamstring, iliotibial band and calf muscles. The soft protective cartilage begins to wear and break down, causing damage, which then leads to the pain and a reduced capacity to exercise. Pain is normally felt during climbing or descending stairs, running, jumping, deep squatting, kneeling, standing up from long periods of sitting with the knee bent, or wearing high-heeled shoes. If left untreated, it can lead to arthritis within the knee joint, so early detection and management of this condition is key. Some treatments can include anti-inflammatory medications, the use of a knee brace or support, and physios can sometimes tape the kneecap to improve the tracking of it during movement. Initially, you may have to reduce the amount of high impact activities that can be causing it. However, in many cases, targeting the weak and tight muscles around the knee and hip with certain exercises will help realign the kneecap and bring back some functional capacity while also reducing the pain. So here are 9 of my favourite exercises for anterior knee pain in 3 groups of 3 that you can do every other day, performing around 8 to 10 reps each for 2 to 3 sets to get you back to what you enjoy. You only need to pick one of the exercises from each group, either A, B or C, that you find challenging and feel as though it's targeting the weaker muscles. But most importantly, it should be pain-free throughout the range of movement. To help you identify which knee is affected in the exercises shown, this will be indicated by my red sock on one foot. The first group of exercises focus on strengthening the quads, and we start with a lying knee extension. Using a folded cushion, rolled up towel or foam roller as I'm doing here, under the affected knee so that the joint is bent no more than 30 degrees. Lift the lower leg and foot away from the ground, sofa or bed that you're lying on to straighten it. Hold it at the end range for a couple of seconds where you feel the contraction before lowering it back down and starting again until you've done it 8 to 10 times. As mentioned, repeat this 2 or 3 times. This can then progress to a straight leg raise. This time, start with the affected leg straight, contracting the quads by locking the knee. Then raise the heel of the foot away from the ground about 12 inches, maintaining the tension in the front thigh. As this is working your hip flexors as well as the quads, make sure your lower back doesn't arch up, so keep the non-affected leg bent with the foot flat on the floor to support your back. The final exercise in this group is the semi-squat. This can be done in a variety of ways, but the key is not to allow the knee joint to move too far forwards as it's bending, as this might aggravate the pain. Make sure you have your feet at hips width and ensure the knees don't collapse inwards. You can use the armrests on a chair to stop you going too low by allowing your bottom to touch it, hence the semi-squat name. The knee shouldn't bend more than 40 degrees, so you certainly don't want your thighs parallel to the ground. Another variation is to use a wall to slide your back up and down, or have a foam roller on your shoulder blades for improved movement, keeping the bottom back as you go down. If you have a strong looped resistance band, you can also perform a Spanish squat, which allows more focus on the quads without placing as much pressure through the knee joint, as you have to stay upright and keep the hips back during the movement. Just be aware that this one burns the quads. Moving on to the second group of exercises to help with hip stability, we start with the clamshell, which is a great exercise for most lower limb and lower back conditions. Lying on your side in a comfortable position with the hips and knees bent slightly, raise the top knee away from the other one to externally rotate the hip of the affected leg. You will feel some activation in the muscles around the hip. Hold the squeeze at the top for a bit, then lower before starting again. You can make this one harder by using a looped band around the knees for extra resistance. You can then progress to the front lying straight leg hip extension. This will target the glutes and make sure that you aim to lift the affected knee of the leg rather than the foot. This will help you engage the muscles in the right way so the hamstrings don't take over. If you want to be really good at this technique, you can try and tilt your pelvis backwards first. This is flattening the lower back and pulling the abdomen in before you begin to raise the leg. This will encourage greater activation of the glutes. Finally, you can try the same movement but led on your side. As you raise the leg up away from the other leg, think about taking it backwards slightly to extend the hip. This will engage more of the muscles and be more effective, but you will feel it on the side of your hip. You can also pause at the top where you get the maximum contraction to make it a bit harder. The final group of exercises improves the joint's functional capacity, including strength for the knee as well as improving proprioception or balance and coordination. The first of these is the single leg step down. You don't need a high step for this, but I'm using the bottom step of my stairs to demonstrate. Standing on your affected leg, drop the other leg down, sticking your hips back as your knee bends until the heel of the foot just about touches the ground, then stand back upright again. Use a support for balance if you need it, but the point is that you find it challenging to balance as well as control the movement. The next one is a single leg Romanian deadlift. This time the trick is not to move the knee joint during the exercise. Therefore, while standing on your affected leg with a slight bend in the knee, hinge at the hip, moving your torso forwards but keeping the knee where it is until you feel the hamstrings on the back of the leg engage as well as your glutes. Then slowly return to the standing position. Again, this will challenge your balance, but be sure not to bend the spine in the lower back, so keep this neutral by keeping your head and chest up as you lean forwards. At the same time, watch the knee of the supporting leg to make sure it doesn't bend any further or collapse inwards. The final exercise is the reverse lunge. Doing this movement as a backward step rather than a forward step will help ensure that you don't place too much stress through the front of the knee. From a standing start, step backwards slowly with your non-effective foot until it touches the ground behind you. Then bend both knees, ensuring your body drops vertically and doesn't move forwards during the lowering phase, and there is no need to drop the back knee to the floor. Only going down a little of the way will ensure that you don't get pain from the movement in the knee. As you come back up, bring the back foot forwards to the other one before starting again. You can do this one slower to work on your strength and balance, and if you're really good, try it with your eyes closed. To summarise then, pick one exercise from group 1 for increased quad strengthening, one exercise from group 2 for building hip stability, and one exercise from group 3 for improved functional capacity. As a bonus, because some anterior knee pain is caused by weakness or tightness of the calf muscles in the lower leg, you can also do some heel raises on the edge of a step to target them specifically, ensuring you go through a full range of movement of the ankle during the exercise. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.